So let me tell you a story, a true story about a man named Raj. So Raj is 25 years old, IT professional, works in MNC, lives in Gurgaon, lives by himself, he's single, and he's introvert by nature. He's had two failed relationships in the past. He doesn't like talking to women because it makes him feel anxious. He keeps on searching about improving the ways he can improve his sexual health by taking some herbs, some vitamins, some supplements, doing some Kegel exercises or whatever. He stopped drinking alcohol and quit smoking, thinking that that will improve his sexual and overall health, which it did. At least that's what he thought. Now, in his office, he has a crush on a woman named Payal, but he's scared to talk to her because he's had two failed relationships in the past. He doesn't know what to talk and he's not confident about himself. But he still likes her and hopes that someday maybe he will talk to her. Now, the trigger incident happens. He was invited to a birthday party of one of his colleagues, and reluctantly, hesitantly, out of peer pressure, he goes there and he attends the party. He stays by himself, doesn't talk to people, doesn't socialize much, and starts drinking. He sees Payal and he wants to talk to her, but he's reluctant. Now, alcohol helped him. He starts talking to Payal. They both have a good discussion, good conversation, share a few drinks, dance together, and a few hours later, both end up at Raj's place. An hour later, Payal walks out of the apartment. And Raj is still there, feeling left out, depressed, lonely, gloomy, sad about what has happened. He goes on the internet, Googles best doctor for sexual health in his city. Scrolls through a few profiles, selects one, and decides to meet him next morning. He meets Dr. Kumar next morning. Now, Dr. Kumar is a doctor, a so-called doctor. He practices in a shady, dingy, low-lit, crowded place. As soon as Raj enters Dr. Kumar's clinic, Dr. Kumar hands him over a packet containing different colored pills, blue, golden, silver, black, worth 30,000 rupees, and tells him, take these medications and your problems will be solved. Raj feels happy, but not satisfied because he wasn't heard. Nobody asked him his problem, but he was happy. Okay, so this might help me. He starts taking those pills. A month later, he feels confident and talks to Payal again, meets her again, and he fails again. He becomes more depressed, more lonely, and out of frustration, he resorts to alcohol. Then years pass, but the problem still remains the same. He becomes even more depressed. And on top of it, his parents force him to marry a woman of their choice. As expected, the marriage failed. Raj ended up in divorce, paying a hefty alimony to his wife. Made him more depressed, more quiet, more lonely, doesn't want to share anything with anyone. So, then he starts moving to drugs. He starts doing drugs, he starts abusing alcohol. And out of frustration, he starts having suicidal ideations. He even tried to commit suicide once. So, the whole point here is basically Raj did not speak to anyone about his problem, nor did anyone ask him. The problems became worse. One fine day, his childhood friend encouraged him to seek help from a professional. Gathering courage, he went on the internet, came across my name somehow, and decided to meet me next morning. He came to me, sat in my clinic, and just sat there quietly. I started asking him questions. He started answering in yes or no. He didn't talk about anything else. For the first 10-20 minutes, we were just having a question and answer session in which he did not open up at all. Then gradually, we started talking about his life, his family, his relationships, his work, and that's when he had an outburst of tears. He asked me, "Doctor, will I ever be able to have a normal life?" I said, "Yes, if you talk to me about your problem, you can have a normal life." He started telling about his problem, the concern which has been bothering him for so many years, the problem related to his sexual health. On discovering what was the problem which was bothering him, I came to realize that that was actually not a problem. It was a deep-rooted misconception from childhood which was preventing him from being himself, from being confident. I reassured him, I educated him on what's right and what's not, I counseled him, and he started feeling better. Fast forward a few weeks later, we've had 3 or 4 consultations, and he starts becoming more positive about himself. Now, as I talk today, Raj is still single. He's still working in MNC. He doesn't talk to people much. He's still introvert, but he's happy with himself. He's more positive. He thinks that the problem is not that big because he had spoken about it to a professional, and the professional told him that the problem is not a problem, it is just a misconception. The whole point here is the healing power of open communication about sexual health. How talking about it can change the perception of the problem. We spoke and he felt better. That is one live example how communication can help people who are suffering from such problems. There is a lot of stigma, taboo in a society like ours, which is bound by culture, traditions. They don't want to talk about the problem. They just want quick solutions or some home remedies, and they feel that this is what is available. They don't talk to professionals. They don't want to find a professional who can help them. Now, to corroborate this thing, I will tell you 2 concepts. One is affect labeling. Affect labeling is something which means you put your feelings or thoughts in words, and that helps reduce the response of amygdala in brain. Amygdala is a part of the brain which is responsible for regulation of stress. Now, when you talk about the problems, when you talk about your feelings, the response of amygdala reduces. And that was demonstrated by a study by Lieberman and his colleagues in 2017. Similarly, the second concept is of sex therapy, which means talking about sexual health with the right person or with the professional. Both affect labeling and sex therapy have been proven in multiple studies and researches to help people overcome their fears and become more confident about themselves. Now, in conclusion, I would like to tell you that talking about sexual health issues is not a sign of weakness, but it is a courageous step towards a more satisfying and fulfilling sexual, emotional, physical, mental life. So there is an age-old wisdom which clearly demonstrates this effect, which says, get it off your chest and feel better. And we have all experienced that. When we talk about our problems to our loved ones, we feel a little better. So talk, talk, talk. Do not suffer in silence. And as I was preparing for this talk, 2 days back, there was a patient who came to me. He addressed his problems to me, sexual health problems, and I asked him questions and we spoke for some time, advised him some investigations and asked him to follow up next day. Next day he came to me and he said that I felt happy, I felt more confident after talking to you. And after I met you, I spoke with my wife, and the problem seems to become less stressful. They had a good time together, and he told me that he doesn't seem to have any problem. So the point is, talking about this problem definitely helps. Now, to end this talk, I would like to give you a small to-do exercise at home. Write down about your most worrisome or most troublesome problem, or talk about it with your closed ones, and experience how you feel better. And that, my friend, is the healing power of conversations on sexual health. Thank you.